that your family has to get the care that they need. And because you know better than anyone that recovery without treatment is challenging at best. So, Mr. Secretary, please tell me, why would you deny millions of Americans the same access to care that saved your life?
We're not denying anybody access to care, Congressman. We're shifting some of the funding away from SAMHSA to the states. The addiction problem in West Virginia is very different than the addiction problem in
Let me ask you this, Mr. Secretary. You've credited the 12 steps in your recovery. So can you tell this committee what is step 4?
It's making a fearless inventory.
Is making a fearless inventory of ourselves.
Yeah.
And you remember that one. And do you remember step 12?
Yeah, it's having had a spiritual.
The hearing room fell silent as Representative Marc Veasey of Texas leaned into the microphone and delivered a warning that cut straight through the usual Washington language. His message was blunt and emotional. This was not just about numbers on a spreadsheet. In his words, this was about life and death. Before we break this down, make sure you subscribe to the channel. These hearings reveal how policy decisions affect real families, and subscribing helps you stay informed beyond sound bites.
The chair now recognizes the gentleman from Texas, Representative Veasey, for 5 minutes of questioning.
Thank you, Mr. Chairman. Mr. Secretary, this country is in the grip of an opioid epidemic that's ripping through America. It's gutting our schools, it's shattering our neighborhoods, and it's tearing families apart. Between 1999 and 2019, overdose deaths involving opioids skyrocketed over 500%. And this epidemic has not discriminated. It doesn't care if you're rich, if you're poor, if you're black or you're white, if you're Democrat or Republican. It takes veterans, mothers, students, and children. Over 240,000 children have lost a parent to opioids, an entire generation growing up with grief and trauma, and over 42,000 veterans lost to overdose. And now, instead of strengthening the VA, the administration you work for plans to gut it, cutting 80,000 jobs, cutting resources from heroes who fought for us. In 2020, 48,000 Americans died from opioid overdoses. Despite historic progress under the Biden administration, where overdose deaths dropped 65% from 2023 to 2024, this administration now plans to cut critical programs and fire behavioral health and crisis specialists, threatening to strip hundreds of thousands of veterans of life-saving treatment to prioritize billionaires over those who served. But most egregiously, in the FY26 budget, the Trump administration is proposing to slash over $1 billion from the Substance Abuse and Mental Health Services Administration. That is literally $1 billion ripped away from treatment, prevention, and hope. Mr. Secretary, you don't slash lifelines in the middle of a rescue. You don't call 911 and hang up halfway through. And you sure as hell don't preach about redemption while cutting the funding that makes redemption possible. So let's be clear. This isn't a budget, it's a death sentence. And now I have a few questions for you, Mr. Secretary. Mr. Secretary, do you believe the United States is currently facing an opioid crisis?
Yeah, and that's why I've reauthorized.
So you do. So do you believe the federal government has a responsibility to combat this crisis, yes or no?
The federal government has a role in it, certainly.
Thank you.
An important role.
Mr. Secretary, you're aware that the president's own brother died from addiction. You've heard J.D. Vance, the vice president of the United States, talk about his mother's addiction. And you've talked about your own history and your own addiction issues in 1983, where you sought treatment for heroin addiction at a rehab facility in New Jersey. Was that treatment effective for you?
I've been sober.
Okay.
I also would point out that I lost a brother to this disease. It's a priority for me, and it's going to be a priority for HHS.
And let me also ask you, do you believe, yes or no, do you believe that structured recovery programs were essential to your own recovery?
My recovery program was mainly.
Yes or no? Do you think that was important for your own recovery?
It was important.
Okay, so Mr. Secretary, overcoming addiction is commendable. I've had family members that have overcome addiction. I commend you for that. But not everyone have the resources that your family has to get the care that they need. And because you know better than anyone that recovery without treatment is challenging at best. So, Mr. Secretary, Please tell me, why would you deny millions of Americans the same access to care that saved your life?
We're not denying anybody access to care, Congressman. We're shifting some of the funding away from SAMHSA to the states. The addiction problem in West Virginia is very different than the addiction problem in SAMHSA.
Let me ask you this, Mr. Secretary. You've credited the 12 steps in your recovery. So can you tell this committee what is step 4?
It's making a fearless inventory.
Is making a fearless inventory of ourselves.
Yeah.
And you remember that one. And do you remember step 12?
Yeah, it's having had a spiritual awakening, we try to help other alcoholics and addicts.
So tell me, Mr. Secretary, yes or no, does cutting off treatment for people still suffering align with step 4 and step 12?
We're not cutting off treatment for anybody, Congressman. As I said, I'm happy to explain it, but you don't give me any chance to answer questions, which is part of the game that we play here.
Mr. Secretary, I've heard your story. Again, I think that it's great that you talked about your recovery. But, man, you can't pull the ladder and shut the door. There are people like President Trump's family and your family that have resources, but there are families like mine and Secretary Vance's.
Gentleman's time has
As we
expired.
said, we're not denying
Time has
we're not
expired.
taking treatment away from anybody.
The subcommittee.
Veasey opened by framing the opioid epidemic as one of the most devastating public health crises the nation has ever faced. He reminded the committee that opioid-related overdose deaths increased by more than 500% between 1999 and 2019. He stressed that addiction does not discriminate by race, income, politics, or geography. It affects veterans, parents, students, and children alike. Veasey highlighted a statistic that often gets overlooked. More than 240,000 children have lost a parent to opioid addiction. That loss, he said, has created an entire generation growing up with trauma and grief. He also noted that more than 42,000 veterans have died from overdoses, underscoring how deeply this crisis cuts into the military community. Subscribe now if you want continued coverage that connects policy decisions to the human stories behind them. Veasey then turned to the role of government and the direction of the current administration's budget priorities. He pointed out that in 2020 alone, nearly 48,000 Americans died from opioid overdoses. He contrasted that with recent progress, noting that overdose deaths declined significantly in the most recent year, a drop he attributed to expanded treatment access and federal investment. According to Veasey, that progress is now at risk. Veasey described that proposal as ripping away treatment, prevention, and hope at the height of an ongoing crisis. He used a powerful analogy, saying, "You do not hang up in the middle of a 911 call, and you do not slash lifelines during a rescue." His conclusion was unmistakable. This was not a budget, he said. It was a death sentence. Subscribe if you want clear explanations of how federal budgets directly affect healthcare access in your community. When Veasey began questioning Health and Human Services Secretary Robert F. Kennedy Jr., he first established common ground. He asked whether Kennedy believed the nation is facing an opioid crisis. Kennedy agreed. Veasey then asked whether the federal government has a responsibility to address it. Kennedy said it does. Veasey shifted the conversation to something more personal. He referenced the fact that addiction has touched leaders across the political spectrum, including within the administration itself. He noted that President Trump lost a brother to addiction, that Vice President J.D. Vance has spoken publicly about his mother's struggles, and that Kennedy himself has shared his own history with heroin addiction and recovery. Veasey asked Kennedy whether the treatment he received was effective. Kennedy confirmed that it was and stated that he has remained sober. He also acknowledged losing a brother to addiction and said combating substance abuse is a priority for him and for HHS. Subscribe now if you want coverage that holds leaders accountable using their own words and experiences. That acknowledgement became the foundation of Veasey's argument. He praised Kennedy for his recovery and recognized that overcoming addiction is an achievement, but he emphasized that not everyone has access to the same resources, support systems, or financial safety nets. Veasey argued that recovery without treatment is extremely difficult, especially for low-income families, rural communities, and veterans. He asked why the administration would reduce access to the very programs that helped save Kennedy's life. Kennedy responded by saying the administration is not denying access to care, but rather shifting some funding responsibilities from the federal government to the states. Veasey pushed back, arguing that addiction looks different in different regions and that states already struggling with limited resources may not be able to fill the gaps left by federal cuts. Veasey closed with a line that captured the emotional weight of the moment. He warned that leaders who climb out of addiction with support cannot pull the ladder up behind them and shut the door on others. He reminded the committee that while some families have resources, many do not, and government programs often represent the only lifeline available. The hearing moved on, but the exchange left a lasting impression, raising difficult questions about budget priorities, personal responsibility, and whether federal policy is meeting the scale of the opioid crisis. If you want continued coverage that explains not just what lawmakers say, but what it means for real people, make sure you subscribe.